Hi, I'm Cecilia Fuentes.
Hi, I'm Nicole Salas.
And we're here to talk to you about concussions. First off, you may be wondering, what is a concussion?
Well, I'll tell you. A concussion is a type of brain injury that involves a temporary loss of brain function resulting from a blow to the head. A person with a concussion may not always lose consciousness. The effects of a concussion can appear immediately or very soon after the blow to the head. It may include sleep, mood and cognitive disturbances, and sensitivity to the light and noise. However, some effects do not appear for hours and even days, and may last for several days or even longer. But when should you begin to suspect a concussion?
Well, if the person was involved in a motor vehicle crash or subjected to another significant force, was injured as a result of a fall from greater than a standing height, is wearing a safety helmet that is broken, has tingling or weakness in the extremities, is not fully alert, appears to be intoxicated, appears to be frail or older than 65 years old, is a child younger than 3 years old with evidence of head or neck injury, and has a sports injury that might expect a concussion. Now that we know what a concussion is and when to suspect it, let's learn how to treat it.
First and foremost, if you think a person has a head, neck, or spinal injury, call 911 or the local emergency number.
Second, ask about the symptoms. Some symptoms include temporary memory loss, brief loss of consciousness, nausea and vomiting, speech problems or blurred vision, light sensitivity, headaches, and repeated questioning about what is happening.
Next, make sure to support the head and neck in the position in which you found it. Maintain an open airway. Control any bleeding and apply dressings to any open wounds. Do not apply direct pressure if there are any signs of an obvious skull fracture.
If there is clear liquid coming from the ears or wound in the scalp, cover the area loosely with a setting gauze dressing. Monitor the person for any changes in condition. And lastly, try to calm and reassure the person. Encourage the person to talk to you. It may help with keeping them conscious.
Now that we learned about concussions, let's see a real-life scenario. The scenario begins with Nicole and Cece running through the park during track practice when all of a sudden Nicole falls and hits her head. Cece then runs over, proceeds to ask if Nicole is okay, and proceeds to introduce herself, stating her credentials and her name. Then continues to call 911, stating what happened. Cecilia proceeds to ask about the symptoms, which may include temporary memory loss, brief loss of consciousness, nausea and vomiting, speech problems, blurred vision, confusion, headaches, and repeated questioning. Next, she supports the head and neck in the position in which she found it. Cecilia is also making sure to maintain an open airway. Then she goes and checks the body to see if there's any bleeding and any open wounds. There is none to be found. Next, she checks if there's any obvious signs of a skull fracture, and if there's any clear fluid leaking from the ears or wound in the scalp. Continue to monitor them and reassure them and tell them they're going to be okay.